I wasn't able to review my slide and I wasn't able to study the A part. But I will do my best to to lecture you with the assessment part. After my lecture, ay, ano naman? After my lecture, you will have your ano na ha, you will have your clinical examination with PREs, Necalye, and the rest of the exercises. With PREs, it's okay if you do not have any equipment to be if you don't have any equipment nga gamiton during the PREs, okay lang. Kung may ara ka mo da mineral water bottle nga may tubig, so okay na maski amo na naanay gamiton. And then with muscle settings, ginto nga namo ng muscle setting kay basi mabudlayan kamo sa inyong mga patients. Okay, most of your patients are elderly. Most of your patients are your parents. So, ang muscle setting, ginto nga lang namon. So, mabalaan nyo lang na karon kung ano nga case ang inyong magabutan. And majority of the management are 5 reps lang and 6 seconds hold para at least hindi magdabudlayan mga parents nyo during the clinics. Mirroring. Okay. Can you see my slide? Can you see my PowerPoint?
Yes, sir.
Okay, we will now start ha. Hala. Kung may masulod, if ever, kung may masulod, ano man nino, may tawag ni man. May alarm man, no? Kaya basi balas ang tanggal lecture ko, hindi ko siya mabatian. Nag-notify ni siya, no? Sige lang, I hope mabatian mo siya. I hope mabatian ko ang iyang notification kung may masulod. May isa pa nga wala kasulod, I think tuwa. Sino pa wala kasulod man? Interns from RCI, kumpleto na kamo. Interns from complete. At may isa nga nagsulod. I think it's Val. Alin na si Val? Okay. May isa pagid. Janine, ginagawa yung mga RCI. Janine de la Cruz.
Good morning, sir.
Sino pa iban mo nga upod ng RCI gani? Si Ryan.
Nico, sir, and Kate Sirius.
Ari na sila?
Yes,
Are
sir.
they
Complete
here?
na kami.
Okay. Ilan the doctors? Are you complete, the 4 of you?
Yes, sir.
Okay, let's not wait kasi naman na ang wala pa. We are supposed to be 31. I do not know kung sino wala pa. Okay. So today we will be lecturing the A part of your SOAP. The A part is the assessment part. The assessment part, it is where we provide interpretation and analysis and professional judgment. Interpretation, what do we interpret? So we interpret the data that we got during the objective taking. What do we analyze? Aside from interpreting the data, we analyze the data that we have taken. We analyze how many percent of assist does the patient require when doing when accomplishing ADLs. The muscle grade, we analyze kung ano ka weak ang ating na patient. We analyze the functional status of your patient, and it is where we put into our professional judgment. Professional judgment. Kung natamo natin, medical professional, kung makuha na natin ang ating nga license, but because kinahanglan natin siya i-practice, para kung ara na kita sa clinics, kung maging professional physical therapist na kita, hindi na kita mabudlayan kung paano natin pahulagon or i-function ang ating nga judgment. So that is why, intern pa lang kamo, you really have to practice clinical decision making at the same time professional. It is the most important legal note. Why? Number one, because this will save you. Say, for example, your patient will file a lawsuit against you. Wala ka may napakita na writings and records sa imong mga patient kay wala ka naghimo sa imong assessment part. So, mapirdi ka sa kaso laban sa imo, sa kaso nga ihatag sa imong mga patient. Number two, most important legal note, because it is where your insurance will pay you. If your assessment part is not good, if your assessment part is incomplete, there's a possibility that the insurance provider of your patient will not pay you. You will lose. Madulaan income ang inyong rehab center. Especially if you are targeting to work in the US, in the America, busisi sa inyong IE sa pasyente nyo. Most of the patient in the US has their own insurance. So kinahanglan siya sa inyong sa ilang insurance provider ang inyong mga data nga na-record nyo for you to be paid. Problem solving process, it is like mathematics. One of the most difficult subjects na ako na-encounter in high school and then in college is mathematics because grabe din ang problem solving sa math. Here in IE, here in the assessment part, we also do problem solving process. Paano naton tagaan action ang problem sa aton patient or our exercises that we will give. Ano ang mga goals natin sa ating na patient. So it's a problem-solving process. In making your assessment part, in making the assessment part of your IE, we have to ask ourselves the following questions. Number one, what is the patient's current condition? Ano bala ang status sa pasyente natin subong? Ang iyang mental alertness, ano ang iyang functional capacity, how does it affect the achievement of their goals? Ang patient, ang status bala subong sang ating pasyente, if hindi namin ang iyang status, will it affect the goals that we will make to our patient? Are we on the track with the goals? Sakto bala ang path na atong ginaagyan para ma-achieve sa atong nga patient ang mga goals na atong giubra sa iya? And next, do we need to modify them or change the direction of my treatment or interventions? It's self-explanatory. The first part of your A of the assessment is PD impression. Now, how do we accomplish PD impression? The first thing we have to do in making PD impression is that we have to define or state the functional deficits and impairment present in the patient. I-check natin, ano ba lang mga functional deficits and impairment sa aton na patient. Next, statement of the probable reason for functional deficit and impairment. What could be the reason why our patient is experiencing this functional deficits and impairment? And last is what can we do about it? What can we do about it? These three are factors that we need to consider in making a good PD impression. Again, first is we have to define or state the functional deficits and impairment. Excuse me. Sorry, tubudlayan ako maghambalin ka mask. So these are the three factors that we have to consider in making a very good PD impression. First, we have to define and state functional deficits of an impairment of our patient. Number two, statement of probable reason na ang patient natin experience ng amuni ng functional deficits and impairment. And the last is, what can we do about it? Now, how do we make PD impression? Number one, the first component or the first factor is define, state the functional deficits and impairment of a patient. After taking a meticulous objective data of your patient, so nakuha mo na ang iyang MMT, ang iyang gonyo, ang iyang MMT, ang iyang ROM, ang iyang functional status, nakuha mo na, and all of your data are already complete. Now you have to make the impression. Define the impairment. So this is how we make PD impression. The first sentence of your PD impression should be this. Patient has functional deficits in the areas of ambulation with walker, on level surfaces and stairs, transfers, sit to stand, supine to seat, and toilet, on and off the toilet. In making your PD impression, always ang pinakauna gid na imo focus is functional deficit, not the range of motion, not the MMT of your patient, but the functional deficit. Maski anong case ang imo nga patient, stroke man na siya, neuromuscular, musculoskeletal condition, sports, geriatric, ang pinakauna gid nga imo nga statement sa imo nga PD impression is the functional deficit. Take it, ara siya. Kita niyo sa slide ko. Don't worry, I will give you this slide as your guide. Next, the second part is state the probable reason for functional deficits and impairment. Ano ang reason? Ano ang reason na ang patient natin may functional deficit and impairment? So, ari siya. Here's the second sentence of your PD impression. Patient's functional deficits corresponds to patient's non-weight bearing on left lower extremity status, an impairment of decreased strength of right lower extremity and bilateral upper E musculature, and a decrease in exercise tolerance and muscle endurance. So that's an example of the second statement that we have to make in making PD impression. We have to state the reason for functional deficit impairment. Now, the last part is what can we do about the limitation and impairment? So that is the closing sentence. The closing sentence for your PD impression is this: an increase in muscle strength and endurance and exercise tolerance should lead to an increase in function. That's an example of an accomplished PD impression. So sa iya PD impression, ara dira naton makita ang tatlong ka factors nga needed naton sa aton nga PD impression. Liwat, these three factors are your number one, define, state the functional deficits and impairment of your patient. Number two, what is the probable reason why this patient of ours is experiencing functional deficit impairment? And number three, as physical therapists, what can we do about it? After making your PD impression, here's another example. So, the first factor is define. We have to define the problem. So the patient has difficulty, probably ang diagnosis ng ating mga patient is shoulder affectation. Maybe this patient could be suffering from a disencapsulitis or peritendinitis calcarea. Patient has difficulty donning and doffing bracer as well as performing overhead activities such as combing hair, putting on shampoo, and reaching overhead cabinet. What is the second sentence? Ano ang second factor? Nag-iba ba sa PowerPoint presentation ko? The second factor should be, what is the reason why the patient is experiencing this functional deficit? So the patient's impairment is maybe due to what? What could be the reason, guys, why this example, why this patient of ours is experiencing difficulty donning and doffing of bracer? Hindi siya kabayaw sa kabot niya, hindi siya kapangmusay, budlayan siya magbutang ng isang shampoo, kag reaching overhead activities. Patient's difficulty and impairment is due to what? Just give me an example. Is due to
Adhesive capsulitis, sir.
no. Anong hambal gani ang second factor? Ano gani ang second factor na ating binabasihan in making PD impression?
It could be because sorry.
Pardon? Yes?
Could be from ano sir, kung may pain ang patient.
It could
Reason niya.
be
Pain.
yes. Ano pa yun?
Decreased range of motion, sir.
Decreased range of motion and
Decreased muscle strength, sir.
decreased muscle strength. Para siya I'm not really asking, ato yung diagnosis gid man sang aton nga patient diri is adhesive capsulitis. But we are not making diagnosis. I am asking for the reason why the patient is having difficulty impairment. So basing sa guide kung paano mag-ubra sa PT impression, the second sentence should be state the probable reason. Ara o natawan nyo bala, kung makita nyo sa example ko, patient has difficulty deficit in areas of ambulation with walker on level surfaces and stairs, transfer sit to stand, supine, and sit and on and off the toilet. That's the first problem sa ako ng patient. Ang una kong maging example sa inyo. Now the second factor or the second factor of in making PD impression is state the probable reason. Someone answered a while ago, The patient could be suffering from adhesive capsulitis. Yes, the patient is suffering from adhesive capsulitis. That's the medical diagnosis of the patient. But according to the guide that we are following in making PD impression, we state the probable reason for functional deficit. So the reason why our patient is experiencing difficulty donning and doffing the bracer as well as perform overhead activities such as this. Patient's difficulty impairment is maybe due to a decrease in muscle strength on left upper E, could be a limitation of motion to amuni-amuni, or could be pain. Now, after that, kung nahimo mo na ang second sentence sa imo PD impression, the third sentence is going to be your closing sentence na. So, paano mo obrahon ang third sentence mo? That is, sorry, I have a phone call. Nag-gets nyo kung paano mag-repeat impression? You know, actually, in students pa lang kamo, gintudloan na kamo na sa school nyo. We know that inibalo na kamo mag-ubra sila. What is our job here is just to review you. To review you guys and not to really meticulously on how to make PD impression. Because before ka mo nag-intern, dapat balaan mo na. So it is not already my fault if you do not know how to make PD impression because in the first place, in your clean ed, you will already taught how to make PD impression. It is not my job here to teach you how to really make a very good PD impression or to teach you meticulously how to make PD impression. All I need to do here is just to review you guys. Okay? Just to review you. Kay balaan ko sa student ka mo, gintudlo na ni sa inyo. So that is how we make PD impression. Now, basing on my second example, the last sentence, therefore, so what do we need on this patient? What is needed for this patient? What can we do about the limitation and impairment of the patient as physical therapist?
Permission to speak, sir.
Mm-hmm. What's your name?
Henzel Cheng, sir.
Okay.
Tagla ko, sir, example sa next, sir. Therefore, a decrease in pain and an increase in muscle strength and range of motion should lead to an increase in function of the patient.
Very good. That's correct. So that is how we make PT impression. During the traditional IE, when we make PT impressions, actually kapos lang siya when we make PT impression. But after several years, the manner how interns make their PD impression has been changed. Siyempre, dapat bago naman kung paano ginaubra ang IE. So amo na nga nag-amo na ni ang pag-ubra sa atong na PD impression. It has already 3 parts. So as I repeat again, the 3 parts are this: definition of the functional deficit, statement of the probable reason, and what can we do about that. Please do not forget this. Now let's proceed. PT diagnosis. How can we make a PD diagnosis? When we make diagnosis, we do not rely on the medical diagnosis of the patient. Take again this slide as an example. The medical diagnosis of this patient could be adhesive capsulitis. But in our IE, if we will make PT diagnosis, take note, we do not follow the medical diagnosis. Hindi pwede nga ibutang natin sa aton IE sa PT diagnosis, right adhesive capsulitis. No, it's incorrect. We have to check on this. So amuni ang apat ang aton nga guide para maghimo sa diagnosis. Number 1, again, check for impairment, check for limitations, check for difficulties, and check for restriction. Ano ang mga bagay na hindi makaya sa ating pasyente when making diagnosis? Ano ang mga pangamudlay kag restriction sa aton nga pasyente? Ano ang pangamudlay kag restriction sa aton pasyente while doing activities of daily living? So this is going to be our guide in making the diagnosis of our patient. Example, here's an example. Impaired motor and sensory integrity associated with non-progressive disorder of CNS. That's a given example in making PT diagnosis of a patient. This patient could be suffering from this patient could be suffering from a musculoskeletal condition, which is not sorry, which is not progressive. It is a non-progressive disorder of a CNS. Another example, a limitation of motion on the right shoulder joint is associated with a musculoskeletal injury, which is not progressive and not considered as disorder of CNS. Another example of PD diagnosis, maximum level of independency in all aspects of ADLs with class 1 to 2 maximum assist is associated to a demyelinating disorder of the CNS, which is considered progressive and has episode of relapsing and remitting. What could be the medical diagnosis of this patient?
Multiple sclerosis.
The patient could be suffering from multiple sclerosis. Yeah, a limitation of motion on right shoulder joint is associated with musculoskeletal injury or musculoskeletal disorder, musculoskeletal injury, which is not progressive and not considered a disorder of CNS. Basing on this, what could be the medical condition of the patient? What could be the medical diagnosis of the patient? The patient could be suffering from a fractured shoulder joint. Patient could have sustained a humeral head fracture. The patient could have osteoarthritis of the shoulder joint, severe osteoarthritis of the shoulder joint. Why? Because it's not progressive and not considered disorder of the CNS. Number two, what could be the medical diagnosis of this patient? Impaired motor and sensory integrity associated with non-progressive disorder of CNS.
Cerebral palsy, sir.
The patient could be suffering from, very good, from cerebral palsy, from that, what did you say?
Cerebral palsy, sir.
Okay, pwede, cerebral palsy. The patient could be it could be pediatric patient, cerebral palsy. The patient could be suffering from Bell's palsy because facial facial movement and sensation are actually disrupted in Bell's palsy, and then Bell's palsy is non-progressive disorder of the CNS, of the peripheral nerve. So that's how we make PD diagnosis. I will not ex- I will not explain further because I assume everyone already knows how to make a good PD diagnosis. Now, problem list. When making problem list, we should consider the following. Number one, prioritization. What are we going to prioritize? We, we prioritize ADLs. After that, the next problem that we will include are the problems that we can address in the in rehab. After that, the problems that we cannot address. When making problem list, always check the ADLs of the patient. If you were able to check the ADLs, functional status of your patient, Sorry, abi ko may nagsulod. Okay, so in making problem list, dapat kayo balong kita mag-prioritize ang problem na ating himuon. In prioritizing problem list, always prioritize functional, always prioritize ADLs of your patient. Number two, problems that can be addressed in the rehab. And number three, problems that we cannot address. Later, I will present that kung ano ng mga problem na hindi natin ma-address sa rehab. Next, our problem should be in order, according to priority. So I always suggest in making, if ever na may ara ako IE nga gina-check, ang una ko gina-suggest in making IE is ginapauna ko ang functional capacity sa patient, ang ila nga ADLs. Kay, syempre, ang muna nga na nagkapalihab ang akong pasyente, kaya gusto nila nga maging functional liwat. So dapat ang muna ang ating unahon na problem sa ating problem list. Gusto nila mag-function liwat sa community. Gusto nila ubrahon ang mga bagay na wala nila na ubra because of the disease that they are suffering. So dapat amuhin na ang atong unahon sa problem sa atong mga patient. Problems should be in order. Next, let's have a long-term goal. I know, kabulo ka mo mag-over long-term goal. What are the 4 parts of the long-term goal? Ano ang 4 ka parts ng long-term goal?
Permission to speak, sir.
What's your name?
Gabrielle, sir,
Okay,
Triveleo.
Abby.
ABCD, sir. Actor or audience, behavior, condition, and degree, sir.
Very good. Si Gabi lang di kaya hibalo kung ano ang 4 parts ng long-term goal. How about the others? I hope everyone knows kung anong 4 ka parts ng ating long-term goal. Because pag mangkututan ikay gina, kung kahibalo, dapat nagsabat tayo na ang miara pa time lapse before someone answered the question. Dapat ang ini siya actually 100% dapat kahibalo na communicate in tudlog na ni sa school para pag abot diri sa amon review na lang kami kag ma-correct na lang kami hindi nga itido na mo tudlo kung paano ubraw ang long-term goal. The 4 parts of your long-term goal is the audience, behavior, condition, and degree. Who is the audience in long-term goal?
The patient, sir.
What's your name?
Hansel Chang, sir.
So I only have 2 interns here. I can only hear Hansel and Gabby answering me. How about the others? Do I only have 2 interns here, Hansel and Gabby? I can only hear 2 familiar voices because if I only have 2 students here, I will terminate this lecture. I can only hear 2 familiar voices. Ano ang ginaobra sa ibang tira? I am losing my interest in lecturing you the 8 part. Thank you. Goodbye.